to all watching and listening to this episode of Chizuba Talks. I'm Tej, and with me today is Dr. Erin Willis. Dr. Erin is the executive director and founder of ParticipAid. ParticipAid. And what do they do? ParticipAid is filling the healthcare gap in hard to reach places. And how hard to reach places? Well, in the serene embrace of the Himalayas. So here they have ancient wisdom meeting modern healing, and they have dedicated practitioners of Ayurveda, naturopathy, acupuncture, and all of these coming together to meet healthcare in these remote places. Sounds pretty perfect. Welcome to the podcast, Erin. I'd love to know more about this wonderful, wonderful deed that you do.
Thank you so much for having me. I'm happy to have a little bit of time to chat with you all. Yeah, it is incredible work. I'm always feel so grateful that I get to be a part of it. And the places where we're working are very, very hard to reach by the government in terms of service and also just geographically. You know, the roads aren't great. So the approach we've taken to address their healthcare needs in these areas they have very little access is just to really focus on the resources that they have available. So we work with indigenous practitioners and local people to really use local resources and their own capacity, like diet, food as medicine, lifestyle, and the native herbal plants that they have there to use for disease prevention and health promotion.
Yeah, that sounds, perfect in terms of sustainability. Also in terms of resources. Now, when you say you are bringing together the traditional medicines and modern healing, how does this work together? Are the people there more accepting of modern medicine, or are the modern practitioners more keen to learn about traditional medicine?
The healthcare system that they currently have is primarily modern medicine. Over the years, their indigenous practices have been all but lost as the world modernizes and the younger generation is more interested in becoming computer technicians or studying abroad. So that system is really at risk of being lost completely now. But what is there is a very a very small but present practice of modern medicine, conventional allopathic medicine as we know it in the West. So they have a small health outpost where they can provide. There's a person who's trained for 3 years after grade 10, and they provide basic medicines, but it's really insufficient, of course, to meet the needs of the population. So what we do is we work with people from that health post who are, of course, they're very willing and interested to gain more resources to support their population. But like just under the surface, there is the local people. They're not too far divorced from their indigenous practices. Like everybody kind of remembers it, when their grandparents practice. So they're very excited to bring it back. So that's a really key component, is just reactivating and nurturing what's already there and empowering and providing additional training to the practitioners to strengthen what practice is already there. And then we bring in our newer, more like highly educated physicians to kind of just strengthen their knowledge and preventive practices primarily. So we have Ayurvedic physicians and naturopathic physicians coming together to create a preventive health curriculum to teach them to the local people. So
that's perfect. Yeah. Do you take camps? Or do you take medical practitioners on a sort of a trip? Because it's the Himalayas after all, right? So you take them on a nice trek, and then you say, okay, you're going to be serving here for a week or 2 weeks and collaborating with the local practitioners. Is that how it works?
That is just that is one like very exciting part of it. I mean, the Himalayas are just like the most beautiful place in the world. So incredible. So many people want to go there. And of course, we're so happy to facilitate that. And they are in dire need of this acute care. We really focus more like throughout the year on the daily practices of prevention so that they don't get these diseases in the first place. Because when we don't bring a camp in, what are they going to do? So that's our primary focus, really to strengthen the everyday practices and the resources that are there on the day to day. But yes, we do an annual camp where we bring in practitioners, a
Uh-huh.
multidisciplinary team, conventional medicine, naturopathic medicine, Ayurveda. We have chiropractors,
Hmm.
acupuncturists come together to then serve the area. So we bring them from all over the world, and we meet in Nepal, and we travel. Now we're working in about 5 villages. So we do after kind of introducing them to the wonders of Nepal, we do a day of service in each of the 5 villages.
Let's take a break to understand what Chizuba is. Everyone at some point ponders on how this beautiful life can be made more meaningful. Maybe you're a leader trying to enhance your employees' experience at your organization. Or you already work for the community and seek volunteers with state of the art skills to strengthen your nonprofit. Whatever your situation, know that you can make a difference. Chizuba began with this very vision, a vision to facilitate every skill and every passion in the world in meeting a social need. Corporate volunteering has several benefits for both businesses and organizations. In parallel, experienced and enthusiastic volunteers join NGO workers, enabling them to serve the community more effectively. Chizuba offers everyone looking to add purpose and meaning to their lives a chance to connect or volunteer virtually with nonprofit organizations from over 100 countries around the world. Visit www.chizuba.net and explore opportunities to find meaning. Chizuba, your platform to do good. And now, back with our guest.
Health practitioners, gynecologists. Also, this year we found, interestingly, there's a large demand for mental health support. So psychotherapists are engaged in this upcoming trip.
Oh, okay, that's interesting.
Mm-hmm.
And when you say there's a camp and you have these people coming, and it is hard to reach, right? So it is going to be a task to arrange for logistics, for accommodation, for transportation, meals. So what happens?
Yeah, tell me about it. It is a very large logistical challenge, but we've been doing this for years. So we have uh, basically just a lot of Jeeps that carry us around. And we have really, I mean, the local people are our hosts. So they have asked us to come, of course, and um, we all kind of have a headquarters. We stay in one village that has actually, in this one village, they have a beautiful, like, man made lake and a natural hot spring. So it's a local tourist destination for Nepali people. So thankfully, there's a fairly nice hotel that all of us can stay in there. So then that's kind of our headquarters. And then daily we just pack everything up and go to our the health posts that I mentioned before. There are hosts for every village. We just pack it up and travel there with jeeps and porters.
Okay. So this question probably should have come at the beginning, but I'm asking almost towards the end. How did this idea of starting a nonprofit to meet the needs of the local community as well as, kind of, it's like a win win situation? Somebody who wants to visit the Himalayas and, do good work. So, how did this idea come about?
Well, I'm a naturopathic physician by training, and I just happened to, like, before I went to naturopathic school, I traveled to Nepal because I'm such a mountain girl, and I wanted to be in the biggest mountains that are in the world, and I fell in love with it and fell in love with the people. Asked them, I was like, I want to live here. I want to help you guys. What do you need? They said, we need a doctor, and I said, okay, I'll do that. So that year I went to I started medical school, and then as a student, I was a student wanting to serve. So it was in the very early stages. I just brought my teachers in school and doctors and nurses that I knew, and we from the very beginning we just started figuring it out. So it just kind of happened that way, the trips, because I myself was a student wanting to learn and go on these
Mm-hmm.
trips, wanting to serve these people. So, and then that was so many people wanted, it was such a great experience. And
Yeah.
then as naturopaths, we use plant medicine. So one
Yes.
thing I'll just mention that really set us apart from all the other organizations is that we would we would make medicine from their local plants. So when we treated them in the health camps, we the medicine that we gave them, we could say, okay, yeah, this medicine, if it helps your symptoms, then you know where this plant grows. It grows behind your grandma's house, and here's how you make a tea from it. And that practice really inspired the local people and created a lot of pride in what they had. And that's just been kind of still at the heart of our work today.
Right. I'm so glad this worked out because I remember just, a couple of months ago, I went on this trek in the Himalayas. And while I was descending, we met a lot of these shepherds. And there was this one shepherd who was in terrible pain. His tooth was hurting. And he came, approached us and asked, do you have any medicine that can help my toothache? And I felt so helpless at that moment because I really didn't have anything. I didn't have any painkillers on me.
Mm.
But it's a good idea to for people who are traveling in such remote places to carry something that could help these people. And I'm so glad that your organization is working towards making these remote villages, these remote communities, um, healthy and taking care of their traditional methods of medicine also. Thank you
Mhm.
so much for talking to us, Erin. Would you like to share your website with us so that people who want to support you can go to your website and support?
Sure. It's www.participaid.org. For better or worse, it's a name that we made up. So it's spelled PARTICIP hyphen AID.org.
Yes, yes, yes. It's perfect. Participate aid. So
Yeah,
wonderful. Thank you so much for talking to us. And I hope people who are listening to this podcast will be inspired to do something to help humanity. Thank you so much.
you're so welcome.